Good afternoon all. Today my topic is on case of through the optic disc pit, a case report of maculopathy unraveled. Chief author is Dr. Soumya, presenting author myself Dr. Apoorva, co-authors Dr. Darshan, Dr. Pooja and Dr. Bindu Malini. Optic disc pit is a rare congenital anomaly of optic nerve head. Optic disc pits are thought to occur in approximately 1 per 10,000 patients without any gender or racial predilection. Although they are typically unilateral, bilateral presentation has also been recorded in around 15% of cases. Majority of cases are sporadic. Autosomal inheritance has also been seen to affect many members. Here now I present one such case of a 42-year-old female patient who presented to our OPD with a diminution of vision for distant and near in her right eye since 3 months. Her history of presenting illness was a gradual diminution of vision in her right eye, which was painless in nature. She also complained of transiently seeing a dark spot in the center of her visual field. She had no history of headache, no history of metamorphopsia, or no history of any color desaturation. In the past history, she gave no history of any similar complaints in the past, no history of any drug intake, no any systemic comorbidities or any other significant history. On examination, the systemic examination turned out to be normal. On ocular examination, in the right eye, our best corrected visual acuity was 6/18 in Snellen's. In the left eye, it was 6/9. The near vision was N36 and N6 in the left eye. In the anterior segment evaluation in slit lamp biomicroscopy revealed a right eye. It was normal with a pupil of 3 mm size, round, regular and reactive. Same as the left eye, the anterior segment evaluation was normal with the pupil of 3 mm, round, regular and reactive. And she was subjected to fundus examination. In the right eye, it showed a grayish oval shaped depression temporally at the optic disc with the thickening of the retina extending along the papillomacular bundle with the arcuate bundles up to the macula with the macular bundle. This is the posterior pole showing in the optic disc showing a temporal demarcation depression with the thickening of the retinal layers in the papillomacular bundle and arcuate with the macular edema. Whereas the left eye fundus examination, the disc was normal with a CDR of around 0.4 and the disc margins were clear and macula was normal with a good foveal reflex. And she was subjected to visual field analysis with HFA central 30-2, whereas in the right eye it showed less sensitivity in the centrally in the probability plot of a total and pattern deviation, suggesting a macular involvement. The left eye visual fields were within normal limits. The SDOCT macular cube, the right eye showed a subfoveal serous retinal detachment with inner retinal schisis and a fluid-filled spaces with a spongy thickening of the outer retinal layers nasally extending up to the optic disc. Her central foveal thickness of the right eye was 839 micrometers, whereas the left eye there was a normal foveal counter with a central foveal thickness of 220 micrometers and the OCT of the left eye were within normal limits. So with all the above examination and the history, she was diagnosed to have a right eye optic disc pit maculopathy. Optic disc pit is a congenital anomaly believed to be secondary to a disturbance in development of the primitive epithelial papillae, but the exact causes still remains unclear. It belongs to a spectrum of congenital cavitary anomalies of the optic disc, which encompasses extrapapillary cavitation, optic disc coloboma and morning glory disc anomaly. Optic disc pit can be associated with maculopathy leading to progressive visual deterioration. Despite advances in imaging, the exact origin of the fluid at macula remains unknown. Although some cases have been reported to resolve spontaneously, most cases require a surgical intervention. So optic disc pit is typically usually an incidental finding. Rarely it may cause a visual field defects and macular involvement leading to optic disc pit maculopathy. So in such cases of any macular edema like CSR, optic disc has to be examined thoroughly to rule out an optic disc pit associated maculopathy. Also in patients presenting with central scotoma or diagnosed to have optic disc pit, macular involvement should be considered for diagnosis and prompt management. Overall, the vas plana vitrectomy with ILM peeling remains the main form of surgical repair for optic disc pit maculopathy. These are my references.
How common is maculopathy in optic disc?
Sir, around 15% of the cases. 50
to 70% of the cases. Okay, anyone?
No, I was just saying, you just written the mainstay of treatment was just PPV. ILM peeling is also,
There are various methods which I will give.
PPV with ILM.
Nowadays, they have also tried to plug in.
Plugging of the scleral
Like
plug and
the
ILM
scleral
peel has been
flap,
various
uh,
techniques. Routinely,
Tenants as well.
because certain percent of the cases vitreous is the at fault traction. So in those vitrectomy, people have used. Okay, people have used. Dr. Sweta, come next.